Today we'll be looking into the life of Charlie McDaniels. She's seeing a therapist for previous trauma and is seeking help. Following an intentional assessment, Charlie's therapist is confident she's suffering from post-traumatic stress disorder. Let's see what's going on in her session today.
Hey Charlie, how are you doing today?
I'm fine, I guess. Yesterday was a little rough.
Did you write about it in your journal?
Yeah, I think I jotted something down about it.
So if you haven't been keeping up with your journal, have you?
Not really. I don't really have the time, and it's kind of hard to keep up with.
Well, as I've told you before, by writing down your thoughts and your feelings of the day and the events that happen, we can take a better look at the detailed events of your feelings in the moment, instead of thinking back a few days, and it will help us both sort out through the events.
I guess so, but I don't always like to think about the memories.
I understand that, but to move on and heal these wounds of the past, we're going to have to talk about these things.
Okay then.
Well, let's start with today. Go ahead, open your notebook, and put today's date at the top, and let's talk about your day.
Okay. So I got up at like 7. Well, my alarm went off at 7, and I was supposed to be at the gym at 8, but I didn't really feel like going, so I stayed in bed for a while. I think I eventually got up to shower, and then I was downstairs at like 10. Had a meeting at 11, but I was kind of late for that, and then I didn't eat before the meeting, so I had to eat after the meeting, so I ate at like 1:30, and then I came here.
Okay, well, a really good way for us to attack this problem is to go onto a schedule. You said your alarm went off at 7?
Yeah.
So if you're struggling to actually wake up and get out of bed, give yourself 10 minutes to sit on your phone and wake yourself up. Then at 7:10, get out of bed, get dressed, give yourself 10 minutes to pick out the clothes for the day. At 7:20, you should be downstairs to make yourself some breakfast. It doesn't necessarily have to be a 3-course meal, but get yourself a little snack to get you going in the morning. At 7:30, you should be completely ready to leave your house and get to the gym by 8. If you're there for an hour, you'll be done by 9, and then you can have 30 minutes to shower and change at the gym. But by 9:30, you need to start your day.
Okay. But how is this supposed to help me?
That's a great question, Charlie. Cognitive therapists will often try and create a functional routine for their patients to put them at more ease.
If you're writing down your future plans and setting times to get everything done for, it'll help to give you a little more structure in your life. Before the breakup, your schedule was up to him. Everything was based around what he wanted. Now we're going to make things about you and your schedule and your success.
Sure, but what about my feelings and my emotions? I still feel like everything was my fault. If I would have just tried a little bit harder, I could have made us stay together.
Charlie is internalizing the blame onto herself rather than correctly project it onto her ex. She's overgeneralizing some few instances of rightful blame onto numerous unjustified reactions from her ex.
Do you really believe that's true? Everything you did had a negative consequence. Was it purely your actions, or did he do something with the breakup?
He only reacted badly if I did something wrong, like if I didn't clean something right, or I was being too loud. That's understandable, right?
So if I were to miss a spot while dusting the bookshelf over there, you should be able to come over and hit me because it's not perfect?
Of course not.
Then it's not okay for him to do it to you.
When you put it that way.
See, it's not okay for him to grab your arm and leave a massive bruise. Neither is it okay for you to be conditioned to hear loud noises because of him. I noticed earlier when you came in and the door shut behind you, it made a really loud noise. You jumped and winced, almost like you were waiting for someone to hit you.
Cognitive therapists will try and find the issue in their patient's thought to then address and resolve the issue arising in their thinking.
I didn't even realize I had done that.
Well, tell me about some other interactions you've had with people. Maybe you met someone new, or an interaction with a family member made you think of a way that you wouldn't have felt in the past.
Well, I went to a coffee shop like this week earlier, and I just met this guy because he complimented me on my laptop case, and then we were just like talking and things, and we found some mutual likes, but when I had to leave, he complimented me and said that I looked really pretty and that I was funny, but I just felt like he was just doing it to get on my good side. Like, he just wanted something from me and didn't really mean it.
Yeah. Well, a lot of times people in these situations tend to interpret praise as flattery. It's not healthy because they also misinterpret the meanings of other phrases as well.
People in abusive relationships will often misinterpret behaviors as more negative extremes, such as suggestion as criticism, disagreement as dislike, and kindness as pity.
Oh, I've never thought about that before. I guess it kind of makes sense.
Well, I think we've made really good progress today, and I think that puts us at a good stopping point. For this session, by our next session, I want you to try and have journaled every day. I also want you to use the schedule we made earlier. You can go ahead and schedule out the rest of your day and journal and try to stick to it.